Well, hello, and welcome to Module 12. During this module, we will be discussing hematologic disorders of children. Now, some of the common and/or serious hematologic problems in pediatrics we will be discussing include sickle cell anemia, hemophilia, HIV/AIDS, iron deficiency anemia, idiopathic thrombocytic purpura, and lead poisoning. So many times, when we're talking about iron deficiency anemia, many times babies will get iron deficiency anemia. It's very common at about 15 months to 2 years old, because if you think about their diet when they're 0 to 12 months, they're eating predominantly milk, right? Breast milk, formula, and then supplemented with a little table food after 6 months. Well, at 12 months, it really switches where their main source of nutrients should be from food, and the milk is just supplementing that, or their liquid. Well, many babies have a hard time, and parents have a hard time with that transition. So a lot of times, the toddlers will be still drinking way too much milk. They're not getting enough iron in their diet, and they end up with iron deficiency anemia. Lead poisoning is another very unfortunate hematologic disorder in pediatrics. So it happens, babies will ingest lead-based paint, the dust from the paint. They'll inhale it or eat it, lick it. And it's in houses that were built before 1978. After 1978, lead-based paints were banned. So it was not sold anymore. But before then, it's the paint that's cracking, peeling, coming off. So even if it's been painted over, if that lead-based paint is on the inside, babies and children are at risk. Kids under 6 are at risk. And lead poisoning can be really dangerous. It can cause physical problems, it can cause mental problems, can permanently harm children's brains, and it actually can even be fatal. So we need to be assessing for the risks that children may have if they're exposed to lead. This module will also look at sickle cell anemia. So please watch the video by Dr. Dora Clayton-Jones. She is another professor at Marquette, but she is also the president of the International Association of Sickle Cell Nurses and Professionals. So Dr. Dora Clayton-Jones gives an interesting perspective on caring for children with sickle cell. Other topics that we also will include in this module are hemophilia and HIV/AIDS. So when you are working with children with hematologic disorders, and when you are working through this module and doing the readings, make sure that you are thinking about what are the unique challenges of caring for these children and their families with these hematologic disorders.